We will move on now to our next speaker, who's Dr. Arthur Frank. And Dr. Frank is well known to me, has been active in areas of asbestos for years and done it both in U.S. and internationally. And I will turn it over to him now to continue with his presentation.
Good morning, everyone, and thank you, Brad, for your introduction. It's always a pleasure to follow my friend Richard Lemon. Dick and I have worked together as co-chairs of the ADAO Advisory Board, the Scientific Advisory Board, and my time with Linda goes back to the earliest days of ADAO. She and I met at an asbestos conference in 2004 in Tokyo, and that became my entry into the world of ADAO. My own work with regard to asbestos goes back to my days as a medical student over 50 years ago when I trained with Dr. Selikoff and did my training at Mount Sinai, and have spent a career now studying the effects of asbestos. I have done and still do research and have spoken about asbestos, as Brad noted, literally all over the world. I've spoken and done research in such diverse places as India and Mongolia, China, Brazil, Colombia, and throughout much of Europe. The story of asbestos is one that continually needs telling, and I'm delighted that my dear friend Earl Dotter is going to be on the program with us and share his story in pictures, which are invaluable in sharing our understanding about asbestos. With many of my ADAO colleagues, we helped bring about the bans in Brazil and more recently in Colombia. It's interesting that Canada, a country that produced more asbestos than any place else, even decided to shut down its asbestos mines, and the fight there from our colleagues north of our border have been successful in bringing that about. Though there are still fights that need to be made. Not only there are fights need to be made, but we still need to not only advocate about asbestos, but educate about asbestos. There is still a great shortfall in physician education. I see hundreds and hundreds of asbestos disease medical records each year, and I just hate to think of how poorly many of my medical brethren evaluate exposures, even when they see a disease like mesothelioma, don't necessarily recognize that this is indeed an asbestos-related disease. And there are many other conditions that go misdiagnosed, asbestosis among them, because of that shortfall in education. We still need advocacy. We learned about that yesterday for those of us that had the privilege and pleasure of participating and watching the film festival. We see that this is an issue all over the world. We know that it's still being fought in Europe. It's being fought in India, a country that I have visited more than 24 times, much of that related to asbestos. We still have a tough road ahead of us, both here in the United States, where the fight continues to have the Alan Reinstein ban asbestos bill become a reality, but also internationally. We know that countries like Russia and Kazakhstan and India and China, major either producers or users of asbestos, block educating the rest of the world about the hazards of asbestos. Not only that, these industries not only pay to have false science produced by unreputable scientists that masquerade as producing honest but truly produce dishonest science. And those of you, some of you may know, but for those of you that don't, some of these industries even send spies out among us, and they have literally paid hundreds of thousands of dollars to people to infiltrate organizations like ADAO and others. So there's still a guardianship that we need about the work that we do. It's unfortunate that it's a legal product here in the United States still, as has been mentioned. about 70 countries around the world have banned it now. But the fact that we buy asbestos and still import it into the United States means we're supporting other countries' industry. We've stopped being able to get it from Brazil because of the successful ban there, but now Russia is continuing to sell 1 million tons a year of asbestos around the world. That means that if we buy a product that kills people from another country, we are condemning others in those countries to death and disease because of our buying this product. We also have before us a growing understanding of the talc issue. We heard from Anna earlier about how her mother was exposed to asbestos, and we're learning more and more about the issue of talc. And we even see that companies that have been literally browbeaten into stopping selling asbestos-contaminated talc in this country continue to sell it in over 150 countries around the world. So we still have a lot to do in terms of advocacy. The last point I want to make is that the world still looks at the United States as a beacon for occupational safety and health issues, not as much as has been the case in the past. I've heard stories as I've sat in scientific meetings in Thailand or Sri Lanka, countries that I've lectured in or done work in. And they say, why should we ban asbestos? The United States hasn't done it. So for all the reasons that I and my colleagues have commented upon, we must work hard to continue to bring about the banning of asbestos here in the United States and to continue advocacy around the world to see that this unnecessary material becomes a relic of the past and is not something that is ever used again. Unfortunately, as Linda pointed out, long after I'm gone too, for the next 50 years or more, there will still be asbestos-related disease occurring around the world, even if we stopped it everywhere tomorrow, and that is unfortunate. So we need to get ahead of this and bring about the ban. So thank you for the opportunity and honor of speaking with you this morning.
Thank you, Arthur.